caught up later on. First of all, I want to thank you for coming to this, my inaugural, if you will, lecture for my practice. I met everyone here, but again, my name is Dr. Blue, and that's my wife and son, Adrian and Josiah, over there, and my other kids around the corner there. I want to thank y'all again for coming out and taking your time out of your busy schedule and coming to hear a little bit about health. And the title of the lecture is basically Living to 100, cruise ship or nursing home. And I know there are many benefits that nursing homes provide for people, but that's not our ultimate goal of where we would like to end up. I personally would love to, I've never been on a cruise ship, but I would love to be able to one day, and especially if I am able, up in age, and healthy enough to do it. So basically, what I mean by that is, having having good health is very essential to a lot of people. It kind of can take a top priority in people's lives. Living to a ripe old age and good health, mind you, is usually one of the highest priorities to most people. Unfortunately, no one, not even a chiropractor, can, and I'm a cervical chiropractor, let me make sure I distinguish myself as that, can guarantee that you will live to be 100 or that you will live even one day in perfect health. And while there are no guarantees, there are things that one can do to help him or herself increase their potential to be able to live longer. And those are things like eating well, exercising regularly, proper rest and relaxation, wearing your seatbelt, not jumping out of an airplane without a parachute, picking fights with people bigger than you. There's a lot of common sense things that people can do to help improve their health in general. And most of these will improve your health, make you healthier, but also make you more productive and to enjoy life a little bit more fully. Now, there are things that are very essential to not only health, but life itself. And I'm going to make this a little bit interactive, so I'm not just staying up here like all the classes I took where the teacher just stood up there and lectured and had me in the back either playing on my phone or either about to fall asleep. So I'm going to make sure that doesn't happen here in this lecture. So let's name some things that are essential to life. What is something that you definitely know you can't go without? Breathing. So air. Water. Food. Okay. That's usually the top three that everybody says. Now, further quiz. Do you know how long you can go without these? Let's take air, for instance. How long can you go without air? Huh?
A few minutes.
Few minutes? 3 minutes. That's the number one answer. 3 minutes. 3 to 4 minutes. After 4 minutes, you usually incur a little brain damage after that, so you don't want to try to test yourself and see how long you can actually go. This is on average. Now, I'm not talking about the swimmers that you just watched in the Olympics and things like that. This is the average person. Okay, how long can we go without water? 30 days without water?
Oh, it's food. You can go with that. Water, you gotta have more.
Huh? 3 days. 3 days without water. Your body is made up of almost more than 90% water. How long can we go without food? A week? Some people say can't go an hour, but for practical purposes, as far as before your health is definitely damaged. How many? 30 days? No. 21 days. 3 weeks. It's the rule of threes, basically. That can help you remember. 3 days, or 3 minutes. Sorry. 3 days. And 3 weeks. Now this is before you start to damage your body. The people that you mentioned about fasting and things like that, that's not the healthiest way to lose weight or anything for your health. And there are different types of fast. Some people, they fast, but they might drink a liquid beverage or a liquid protein or something to keep their body sustained. But absolute, without a doubt, any type of food or protein, carbohydrates, fats, 21 days or 3 weeks. Now there's one more thing that's essential to health and life itself. And I'm going to just write this at the bottom. Nerve energy. Now, does anyone know how long you can go without nerve energy?
You can't.
You cannot go 1/100th of a millisecond without nerve energy. Without a nervous system, you cannot live. Without it working properly, you can't be healthy. You cannot even fully enjoy the maximum benefits from eating healthy, from exercise, from rest, unless your body has a good nerve supply. Now, chiropractic is intended to improve the nervous system by removing interference to the nervous system that is there by vertebral subluxation. Now that's our big fancy word in chiropractic, subluxation, which basically means a misalignment. And when it comes to upper cervical care, we're talking about an upper cervical misalignment in those top two bones. We at Blue Up Cervical Chiropractic believe that this service is so important that we have devoted the rest of our lives to sharing the chiropractic story with anybody that'll listen. And in some cases, to people that won't listen or don't want to listen, you know, but it's my job to get the message out there. And if it's received, then great, I can help and benefit someone's life and help improve someone's life. And if they don't listen, then the consequences are theirs to deal with. But I have to get that burden off of myself and do what I've been called to do. Now, a friend or a loved one of yours also thinks that this is so important that they've invited you and requested that you attend this lecture of mine this evening. And I thank them for that, and I hope if you see the benefit of what they've been going through or that they learned about, that you will benefit from it and then grow to like it and love it and thank them as well. So I mentioned the thing about a subluxation, and in explaining the subluxation, I got a kind of a little video I'm gonna have you watch, which some doctors that I've worked with, one particular that I trained from, one particularly gave my wife her first upper cervical correction and got me actually involved a lot more into the technique that I've chosen. So just briefly, this is going to explain a little bit more for me.
Well, buildings technical term subluxation just means that there's a misalignment of one or both of these top two bones in the top of your spine, the atlas or the axis. So you don't have to be concerned about the term. What you do need to be concerned about is if you have a subluxation and the negative impact that it's having on your body.
1/3 of the nerves up here produce pain when they're pinched. 2/3 of them don't. So you see, 2/3 of the people are walking around like this saying, I don't need a chiropractor, I feel fine, okay? And they feel fine because the body has produced certain chemicals that deaden the nerves. Otherwise, we would all have just unrelenting pain. And so these hidden subluxations, sadly enough, are common as cavities.
Picture if you have an electrical panel in your garage that runs electricity to your entire house. If the switches down below you flip those breaker switches, they run power to the regions of the house, but that main power switch turns on power to the entire thing. So if you don't get these two bones back in alignment in this upper cervical spine, it's like that main power switch. You're not getting that information to that entire house. Your body can't function or heal properly.
The challenge that you have with vertebral subluxations is the fact that the vertebra is just not moving and it's crushing and compressing the nerves. And the end result is that the person can start spiraling downhill, especially if they're using a lot of pharmacological agents, because there isn't a drug in the world that's going to move the atlas back into position.
And so that's one of the unique dynamics of upper cervical care. An upper cervical care doctor is not chasing after pain or symptoms. They're going right for the cause of that disease or ailment, which is the subluxation. And we're talking about precise corrections here, sometimes millimeters, sometimes even a fraction of a millimeter.
That particular 1 millimeter at the atlas, that particular 1 millimeter could cause you to have asthma. It could cause you to have reflux. It could cause your heart to not work properly. That 1 millimeter affects your nervous system. And because the nervous system controls everything, that's why that has such a powerful impact.
When your top vertebra dislodges, the rest of the bones all the way down the spine go out of alignment. It's called spinal compensation. When you put the top one back in, through muscle memory, the muscles literally pull the rest of the vertebra in. It's called spinal decompensation. And as those changes take place, the neurological pathways come back to life and the body virtually mends itself. And this is why we chiropractors say that we don't cure anything. It's the body that does the curing.
So that's what I say. I'm a facilitator. I remove the interference and I just watch the miracles that happen in your body.
The female doctor is the doctor that trained me, that I took all my certifications from, and she's the doctor that gave my wife and my kids their first upper cervical correction. And she's a very passionate lady and brilliant mind. And I was fortunate enough to not only be trained by her, but the other 2 gentlemen that were in the video. I meet with them on occasion yearly to talk and get an email from the one every week, and he sends out information that can help build my practice, build me as a doctor, and help me educate patients and the world about upper cervical care, because that's our mission, is not to just affect just a small population of people within our practice, but to kind of use it to infect more people in the surrounding areas, kind of almost like in a biblical sense. We're looking out for our Judea, Jerusalem, outreach and telling the message, kind of like missionaries almost in the chiropractic world, because there are not many upper cervical doctors in this country. And a lot of people are more aware of your general chiropractor, the chiropractor that does twisting, turning, popping, cracking, the one that only see neck pain and back pain, or not only see it, let me rephrase that, that's mostly see neck pain and back pain, and what we are known for in society, and from the medical standpoint, what we're only good for is neck and back pain. But I digress from that, and I got so much in my head I would love to share, but I have to keep myself on focus and stay on my agenda. So I'm going to remove the doctor's hat for a second, and I'm going to become a relationship counselor for a minute. All right? Now, what if you ever went, remember my wife had never gone in counseling, so I don't know that. But if you ever go to any kind of counseling, the one thing, what's the one thing they're going to tell you that's the most important thing of all? Communication. Communication. Without communication, you're looking at the death of your relationship. Well, now as I put back on my doctor hat, I'm going to show you how communication within your body can do the same thing, or the lack of communication can do the same thing. This is my drawing. Don't laugh at my drawing. This is supposed to be a safety pin. So now that I tell you what it is, now it comes with my wife is the artist, and I couldn't just have her running back and forth.
He didn't ask me to draw it.
But this is the safety pin, a safety pin. Now, I'm going to show you how the communication between your brain and your body helps to determine the functioning of your health. Now, there are a lot of things that we see as that society promotes as health, either the way you look or the way you feel. So I'm here to dispel that that's not the true measure of health. Because if it's the way you look, there are a lot of people out there that look fit. They may run 5 miles a day, they may eat healthy, only vegetarian meal, but how many times, or if you have ever heard of somebody that just dropped dead of a heart attack, at a young age and say, man, he was the healthiest person I thought I knew. And he ran 5 miles a day, he ate healthy, but he had a heart attack. How does that happen? So it's not actually the way he looked on the outside. Okay, so is it the way we feel? Okay, let's look at that. Now, I use this example quite a bit, but when does a woman find out that they have breast cancer? When they go to get their annual checkup, their mammogram. And they go in and the doctor say, I'm sorry, you have stage 4 cancer. Well, she say, doctor, I've been feeling great. Nothing, I've been doing everything I needed to do. I've been feeling fine. But still you have stage 4 cancer, breast cancer. So it's not the way we look and it's not the way we feel. So what is it? It's function. Because if everything's functioning properly and as it should, then that's the true measure of health. So this top of the safety pin is going to represent the brain. This circle down here is going to represent the body. And within the body, it could be various systems within the body, whether it be the immune system, your digestive system, your vascular system, or even just things that are going on even back into the brain itself, because the brain itself is innervated by nerves, just like everything else in the body. So to communicate, there has to be a cycle of communication between the brain and the body. So just like the safety pin, as long as it's closed, you have information coming from the brain to the body and from the body to the brain. Now, as long as this safety pin is closed, that cycle can continually run efficiently. But when that is broken and that safety pin is open, now we have a problem. Now we have the brain sending messages to the body, but the body cannot respond back to the brain because there's a problem there. Or vice versa. There's something going on down in the body and it's trying to communicate to the brain to say, help me, but the brain is not getting those messages. Lack of communication. Lack of communication leads to death. Leads to death of an organ system. It leads to death of cells. It leads to total health destruction. So this thing about the subluxation that you listened about and that I've been talking about, I have a great example of how the body can heal itself, and I'm going to use a rubber band for that. But before I get to that within the communication of the body, in upper cervical we say that there is an inborn wisdom inside of you that controls and runs your entire body. You know, I have 8 principles that I've adopted from some readings and another author and another chiropractor that I've been beginning to instill into my practice about the philosophy of chiropractic and how I want my patients to understand what it is that I actually do. And that's the first premise, the first principle, that there's an inborn wisdom inside us, that thing that's inside us that tells us how to digest our food. The thing that has you sitting there breathing and blinking. Those are things that you don't think about. You don't have to think about. You know, no one thinks about the food they ate earlier and how they're going to digest it, how the sugar is going to come from the food and get into their bloodstream and go to where it needs to go so that the insulin from the pancreas can distribute as much as it needs to help carry that sugar to where it needs to go. We're not thinking about that. That's an inborn wisdom. That's what we refer to as innate. Innate stands for inborn. The innate intelligence that's in your body that's controlling and running it. Now, as my second principle is, I'm an upper cervical doctor. I correct vertebral subluxations only. I do not diagnose or treat any symptoms, diseases, or conditions. That's for the medical world. But I do know that if there's a problem at the level of the brainstem, a subluxation that's decreasing the amount of nerve energy going from your brain to your body or to any part of your body that's failing, and if I remove that, then I open up or I close that gap, that chain back of communication between your brain and your body. Now, I believe, and upper cervical believe, that the body has the power to heal itself. So, has anyone ever had a cut How about any broken bones? I've broken a few. Yeah. Well, if you have or if you have not, you understand that you don't take any medicine to heal that cut. You might keep it clean, put a bandage on it, keep it away from the elements or any further trauma. Just the same thing about a broken bone. The doctor will put a cast on it, but he doesn't give you any injections or he doesn't give you any medication. He may give you some medication for the pain, but doesn't give you any medication for the healing process. That's something that happens within you. That comes from inside, not from outside. So healing comes from above down, inside out. And that's the way a cut heals. That's the way the bone heals. The bone heals from the inside out. The cut heals from the inside out. So the body has the potential to heal itself. It just doesn't need any interference in that process. So I have a rubber band here. I was going to give one to everybody, but I figured I'll just subject myself to the punishment and not everybody else. So I'm going to wrap the rubber band around my finger, and then we're going to pretend that the rubber band isn't there. This is going to be my example of what a subluxation can do. So go keep on talking, and if I'm lecturing and I don't know the rubber band's there, then all of a sudden what happens to my finger? It starts to feel a little funny. It kind of starts to turn red, So the first thing I do, I start massaging it, trying to get some blood flow back in it, trying to, stop it from tingling or it's starting to get numb a little bit. So, the massaging isn't working. Okay, so I'm saying, man, this is really starting to ache now. The pain is starting to come out a little bit and get worse. So I'll take a couple Advils or Motrin or some kind of pain reliever to help with that. A day goes by and it's getting worse. The color is starting to go from it now. It's starting to go from red to white now. So it's not getting any blood flow and the pain is getting excruciating. So I got to go to see my medical doctor. I say, Doc, I've been having this for a couple days. I just don't know what's going on with my finger, so the doctor's going to look at it. He said, what have you done for it? Well, I tried massaging it. I took some Motrin for it, but none of that's working. So the doctor said, okay, I got something a little stronger. Let me inject maybe some corticosteroid in there or some kind of heavy-duty pain reliever in there to see if we can at least reduce the pain. So the doctor do that. And then you come back the next day, Doc, something's still not right. That medicine you gave me worked for a little while, but now the pain is back, and not only is it back, it's back worse than it was before. So the doctor said, okay, well now it's really turning blue, and it's really looking bad. So let me go in and maybe we can do some vascular bypass to it. Maybe it's not getting blood flow, so we can go in and do a little minor surgery and fix the blood vessels in there and try to reroute some things to get the blood flow going again. Say, okay, that's my next step. Okay, so you do that. You have a little minor surgery, and with any kind of surgery, there's some recovery time, and after the recovery time, you say, Doc, I don't know what you did, but this thing's still not better. And Doc said, okay, well, I'm totally lost with what's going on, so I tell you what we can do. We can cut that part off and save the rest of the finger, and that way you won't have to worry about it anymore, and then you won't have the pain anymore, and then you just have the rest of your finger. How about that? And lose my finger? Don't you know what's causing this? And the doc said, well, no, I gave you some pain reliever, I did a surgery on it, nothing. Then when in all actuality, all you have to do is just remove the interference. Remove that rubber band. The blood flow comes back, the numbness and tingling stops, the feeling, the movement, all comes back. Because what our society and the medical realm want to do is symptom care, symptom relief, immediate response through symptom care, as opposed to looking for the cause of what may be causing your problem. So that's what an upper cervical subluxation can do to the brainstem. It's the only two bones up in that area that come in direct contact with your nervous system. And your brainstem is like the switchboard operator from your brain to the rest of your body. It controls everything. The messages come from the brain, go through the brainstem, and the brainstem directs it to where it needs to go. If there's a misalignment at that area, then it can start to decrease those nerve impulses going to the digestive system, the immune system, you know, the heart, you know, the pancreas, various parts of the body, causing it to become unhealthy, malfunction, or in some cases shut down. Now, I'm not, you know, and by no means a medical basher. I believe that, you know, they have their place and we have our place. We're separate and distinct. Another one of my principles is that chiropractic is no substitute for medical care, nor is medical care a substitute for chiropractic. They're totally opposite poles, total different agendas, total different intents. And my goal is to help people become more aware of what's out there as far as healthcare. Because people have to start becoming more responsible and taking responsibility for and making the decisions concerning their healthcare and not the doctor. So my goal is to aid in that. So I have a couple stats that I want to finish with, and when I want to preface this by, these aren't anything that I made up. I got these straight off the website. For one, the Journal of the American Medical Association. These are things that are in public view if you just go and search and look for them. Now, the first thing I want to talk about is, who can name? I've been doing a little bit too much lecturing, so I got to get back interactive, get you to answer some questions. So who can tell me what's the leading cause of death? Heart failure. Okay. Let's put this right here. Well, I'll just put it as heart disease then. Bless you. It's not number one, but it's up there. Does anybody know what number one is? Or what's above or below? What's the next thing you can think of that cause? Cancer. You can speak up, John. You can speak up. Cancer. But that's down there, number 3. Oh, what's this right here? Does anybody know this word? I'm gonna write it for you because I don't think. Do I know what that word is? Okay, you can't say anything. Does anybody know what this word is? Iatrogenic. That's the word for medically induced. So, the top 3 are medically induced, heart disease, and cancer, according to the CDC, Center for Disease and Control. So, now, with that, I'm gonna give you a couple numbers. And before I want to read this to you, that's right on the website. This was a study they did called Death by Medicine in 1999. The reference report shows that the number of people having in-hospital adverse reactions to prescribed drugs to be 2.2 million per year. The number of unnecessary antibiotics prescribed annually for viral infections is 20 million per year. The number of unnecessary medical and surgical procedures performed annually is 7.5 million per year. The number of people exposed to unnecessary hospitalization annually is 8.9 million per year. The stunning statistic, however, is the total number of deaths caused by conventional medicine, which is an astounding 783,936. And by comparison, well, they go on to say it is now evident that the American medical system is the leading cause of death and injury in the United States. And by comparison, in 2001, the deaths according to heart disease was at 699,697, and for cancer was 553,251. Now that in itself is a little startling, and I didn't want to memorize all these numbers, so that's why I printed them out so I can make sure I had them exact. You know, when you're practicing upper cervical care, I'm one of the most analytical people you're going to find, and I want my numbers and I want everything to be exactly how they should be. So I wanted to quote these numbers exactly as they have them on their website so that you understand. So that was in 1999, and then these are the numbers in 2001. But I'm here to give you a little bit more shock value to this lecture. According to the CDC, in 2007, just 5 years ago, the number for deaths medically induced grew to 1.7 million. Yeah, more than double. 1 million more deaths between 1999 and 2007. If you're interested about heart disease, it went to 619,067. Cancer, 562,075. Heart disease went down, 80,000. People becoming more aware of heart disease and healthy living. Cancer increased, 9,000. But this, a staggering 1 million increase in 8 years. So people need to be aware of an alternative to health, and not just the medical mindset that the world has us in. And the last paragraph is so eloquently stated in my mind by these researchers. It says that we placed this article on our website to memorialize the failure of the American medical system. By exposing these gruesome statistics in painstaking detail, we provide a basis for competent and compassionate medical professionals to recognize the inadequacies of today's system and at least attempt to institute meaningful reforms. Well, I have the passion, I just need the venue. I do have a venue now. It took me some time to get to the venue, going through school and learn all this stuff. Couldn't wait to get out and start telling the story, and making people a little bit more aware, a little bit more conscious of what they can and what they are allowed to do, if you will, in the medical world, is choose your own form of health care. Now, I'm going to finish with this last one, and again, I'm not trying to bash the medical, but this is right there in plain sight on their website if you go look. This one right here, this is brand new, August issue in the Journal of the American Medical Association. It's called Preventing Patient Harms Through Systems of Care. The Centers for Medicare and Medicaid Services recently launched Partnership for Patients, an ambitious national effort designed to substantially reduce 9 types of preventable harm and hospital readmissions. These harms include adverse drug events, catheter-associated urinary tract infections, central line-associated bloodstream infections, fall injuries, pressure ulcers, surgical site infections, venous thromboembolisms, ventilator-associated pneumonia, and obstetrical adverse events. Thousands of hospitals have agreed to participate and choose to focus on several harms because it is beyond their capacity to simultaneously address all 9 types of harm. The dilemma is that most patients are at risk of all the 9 harms and other harms, including loss of dignity and sense of respect for their values. Yet patients can expect physicians to focus harm reduction efforts on just a few of these harms. Healthcare is addressing these harms as if each type occurs in isolation. This reaction has occurred because it is too burdensome to attempt to reduce multiple harms at the same time. Too burdensome. The siloing of preventing patient harm is inefficient. Healthcare needs a different approach to reducing patient harm. This is from MDs, medical doctors, on their own measures of treating patients. And if they're talking that way about their own methods, their own profession, you know, it got to make you think, you know, what is it that they're not giving out to the public to make them aware of? So, you know, at the end of today's lecture, you know, those that are not a patient, I would ask that if you would like more information, like to get checked to see if you do have this subluxation, or to see the state of your nervous system, and see if you're either getting healthy or you're getting sick. There's no two ways to go. There's nothing right in the middle. And if you do have a vertebral subluxation, then the possibilities of you getting healthier are slim to none, because it's a degenerating process that happens over time. Another one of my principles is that the innate intelligence that is within you is only limited by the limitations of time and matter. And it takes time to get sick or get into a state of dis-ease, not disease, but dis-ease. And it also takes time to get in a state of health. The sooner you can get your body going in the right direction towards health, the better your body is going to be. If you continue to put it off until a time where you start to develop those symptoms, start to develop those aches and those pains, then your body is already showing you that it's already too late, that it's already begun. Then you have to stop that process before you can reverse that process. So I have a patient of mine